tear film breakup time. You could see in some papers it could be called like TBUT or TFBUT, and tear film breakup time is a method for determining the stability of the tear film and checking evaporative dry eye. In testing for TBUT, a sodium fluorescein dye is added to the eye and the tear film is observed under the slit lamp while the patient avoids blinking until teeny dry spots develop. In normal eyes, TBUT values range from 3 seconds to the maximum 132 seconds, and with an average of 27 seconds. So if you see that the result more than 20, you can consider that your patient have a normal ocular surface. And in the opposite case, when TBUT less than 10 seconds suggested then abnormal tear film, and with the values of 5 till 10 seconds considered marginal, and less than 5 it's indicative of the dry eye. Schirmer test without anesthesia drops. And the Schirmer test is also known as the dry eye test, tear test, the tearing test, and the basal tear secretion test. All these names you could see also in many sources. And the Schirmer test is primarily used to diagnose the dry eye syndrome, and the privilege of this test is like both eyes may be tested at the same time, and the normal result show when it's over 10 millimeter per 5 minutes. Corneal staining with fluorescein. Corneal staining, fluorescein staining of the cornea is performed by first placing a drop of sterile saline on a sterile fluorescein strip, and the fluorescein is then placed in the inferior cul-de-sac of the eye by pulling down on the lower lid and gently touching the bulbar conjunctiva with the fluorescein strip. So your patient is asked to blink to distribute the dye, and you as optometrist are using the cobalt blue light to determine if there are any corneal epithelial defects. So patient's eyes are observed with cobalt blue light and in high illumination. And it's also recommended to wait 1 to 3 minutes to assess fluorescein staining after installation of the dye. And the installation of fluorescein for tear film breakup time. To measure this clinical test, fluorescein strip is moistened with saline and applied to the inferior cul-de-sac. Patient also is asked not to blink while tear film is observed under a broad beam of cobalt blue illumination as well. The tear film breakup time is recorded as the number of seconds that elapse between the last blink and the appearance of the first dry spot in the tear film. Conjunctival staining with lissamine green and rose bengal. So strip also as before with fluorescein is moistened with saline and applied to the inferior cul-de-sac. After the installation of the dye, the eye is examined with the slit lamp by a microscope using standard settings like white light and high illumination. The ideal time to measure the presence of staining should be approximately 3 to 5 minutes after the drop installation. Okay, the Schirmer test. The filter paper is folded 5 millimeter from one end, and usually if you are using the paper what is with millimeters scale, There is a notch in the filter paper 5 millimeters from one end, which indicates the point the paper is to be folded. Because when I was preparing for this lecture, I also saw some sources showing like some optometrists are using just a piece of paper and they are drawing with the pen these marks. And the folded tip is inserted in the lower lid at the junction of the middle and outer thirds of the lower lid. And you should take care not to touch the cornea or lashes. The patient is asked to keep their eyes closed for the duration of the test. And after 5 minutes, the filter paper is removed and the amount of wetting from the fold is measured. So, how to measure the tear meniscus height? For tear meniscus measurement, the patient is also positioned at the slit lamp and instructed to look at the target located a main primary eye gaze. And to avoid reflex tearing, a short light beam, like 3 millimeters wide and 5 millimeters in height, of moderate illumination is used to prevent the light shining directly into the pupil during the measurements. And also high magnification, like 40 times, plus direct focal illumination are used for the tear meniscus height measurement. Now I'm going to show you some short video how to apply for the first video the tear film breakup time, and for the next how to apply a corneal and conjunctival staining with the dyes what I have told you before.